I'll introduce myself. I am Patricia Zondervan from the Netherlands. I'm one of the urologists. Since 1 year I'm a urologist over there. Before that I had my residency for 6 years in the Netherlands, and I'm now 38 years old. And I would like to tell you something to be a woman in urology. And I can also tell you that I've been studying first medical biology for 5 years. I've done 2 years of research, basic research, and well, in Holland you have a lottery, so you cannot start for studying medicine immediately. So I had to wait for 5 years, and during that 5 years I finished my medical biology. At the age of 23 I started with medicine, and very quickly I knew I wanted to do something in the surgical field. Yeah, well, it's a matter of feeling. You have when you come in as a resident or a student, when you can just look around the internal medicine, the general surgery, and then I went to the urology, and it was just a matter of feeling the patient group. There were nice patients. You have the older patients, the men with the prosthetic problems, but you also have renal tumors, bladder tumors, and it's very a mixed group of patients.
How do the male urologists treat female urologists when they come into the business?
Well, actually good. They are very gentlemen, very sensitive in the way you do things. They are open for discussions. They're well, I never had any problems by not being accepted as a woman. You need a little bit surgical point of view, that's for sure. You have to know what you want, and to act sometimes in acute situations. So you have to be sure about things and not to doubt. So that's, well, I think, one of the skills you need to have as a general, or if you are a surgeon. Some patients emphasize that, for example, a male patient with a sexual dysfunction, sometimes they tell you, well, I'm happy you're a woman, because towards a man I cannot tell I have a sexual dysfunction, because then I feel a little bit stupid, but a woman just perhaps understands me and looks from another point of view. So I'm happy that you understand and that we can talk about it, because you are in a professional setting. So they will always tell if you're just a professional doctor. Well, once I had a patient and he said, yeah, I prefer a male doctor. Yeah, okay. I said, then we make another appointment with my colleague. So, and that's no problem. Absolutely, absolutely, yeah, yeah. Family, yeah, I have a family. I have a husband, and he is a maxillofacial surgeon. He has also a very busy job, and I have a son of 2.5 years old, and I'm now pregnant, and I'm now on the IAU now, so everything is possible, I think. Yeah. Well, it's very good possible, absolutely, because I have my social life. I have a lot of friends. I make dinners for my friends at home. On the other hand, I go to work. I have all days of surgery, and then late in the evening I come home. I visit my best friend, so everything is possible. Of course, sometimes when you're on call, you cannot drink and you cannot go to parties sometimes. But okay, that's you have to do something for it. But I think you must be enthusiastic about it. You must have the feeling, I really want to become a urologist, and when you have that feeling, you have to go for it and just do it, and you will find, if you are enthusiastic, you will find all the people, male, female, and they will support you and will make you what you are going to be in the future.